This is a very interesting question because much like grief, trauma is not something that happens in a linear way. It's not going to be this is going to be a 6-month trauma-informed therapy session. I can't give an answer to that. It depends on the type of trauma. It depends on the individual's coping mechanisms. It depends on how long that person has been denying that trauma and trying to ignore it or suppress it or push it away from themselves. It's all very dependent on the individual. I have seen trauma clients do 4 weeks and they're out of my care because they are fine and they have fixed what they need to fix. They feel more in control of themselves. They feel safe, secure, and they can handle things. And I also have clients that have been in my care for 2+ years trying to continue to work through the complex trauma that they have endured. It's a hard thing to put a number on. I think what matters is the effort that you are willing to put into the therapeutic process, how diligently you are willing to work on the coping mechanisms, the homework, the processing. How long a trauma therapy session or set of sessions takes really depends on the individual. But I like to tell clients that you get out of it what you put into it. So if you walk into therapy and you're serious about it and you do the homework, you work on these things, you're probably going to be in there a shorter amount of time than somebody that doesn't want to do those activities, that struggles or pushes back on the homework. But again, that largely depends. It's a very dependent situation on a lot of different things, but it does not have to be in a specific amount of time. What matters is that you feel ready to leave.